We have about 3 different parts of our service. We cover a long-term domiciliary care. We have a prime team, which is to re-able people when they come out of hospital or if they've had a fall at home. Rapid response, which is to prevent hospital admissions. And we also have a waking night service, and that operates from about 11 at night till 7 in the morning. So we're a 24-hour, 7-day service.
CM software we wanted to bring in because we had a lot of paper-based rotas. We used to give them out to the staff, and we wanted to cut down on missed calls, time management of the staff, to make sure that we had a better running system and cut down on wasted time and travel time for the staff.
Before we introduced CM, we were using Microsoft Excel to create our rotas.
Because our service is such a quick turnover from sending them rotas out, there could be a change later that day or the next day, and then they were having to ring all the girls and say, this has changed, you haven't got this person anymore, or this one's come in, can you add this on?
And every week you had to go to the office and pick up your paper rota and see what service users you had on and take your rota out with you and obviously tick off when you had been.
CM's had a massive impact on the quality of service and care we provide now.
The benefits, it's saving a lot of man hours as a senior, whereas I can now go out and see more clients myself, and I can go straight out to that client, or I can change somebody's rota if they need to do it. Before we were using CM, it was long. Very long, and a lot of man hours wasted, whereas this has probably shaved off about 40 hours a week of my working week.
Communication with the care staff is greatly improved. The girls are able to send real-time information straight to us, which is recorded against a client's record, which can be viewed at a later date. It just allows us to manoeuvre work very quickly, respond to emergencies, and save money and time.
All the staff have embraced it, even though we had really an ageing staff who hadn't used technology before, and now they are saying, goodness me, I wouldn't know what to do without my phone now with this app on, and they just absolutely love it. It's great.
Sometimes if you're really, really busy, you haven't got time to keep ringing people all the time, which is what they had to do when they were using the spreadsheets, because that was the only way to pass information on. So you can just send them a quick message, like through as an alert, then you know that they're going to get it.
We can just pop it up onto the CM screen and it goes straight onto the member of staff's phone, and they can't do anything until they've actually read that short message.
You can check whereabouts they are in the area as well. Say if a service user rings up and basically said the carer's meant to be due at 10 o'clock and it's now 10:30, you can check exactly where they are and where they've been beforehand, and then you can say to the service user, right, they're actually on their way, there'll be 10 minutes, so don't worry, there is actually a carer coming.
The service users just embrace the service a lot better by having that technology. They can ask who's coming in, and the staff at a flick of the phone can say, oh well, you've got me today, or you've got such and such tomorrow, and they've got all their information to hand around the medication, all of that kind of thing. So it's a much, much better system.
I can actually basically stay out all day because of the CM app on my iPad and do everything that I need to do. I could do in the office, I can do out in the community.
We can run reports off the system at a minute's notice, either on just the reports itself on CM, or we've got CMBI where we can run more strategic type reports for senior management, which that's what they're looking for. Reports around staff and the service users, so it's a very, very good way of keeping a check on the system.
I really, really enjoy using the CM software. It's absolutely spot on. I find it really, really good.
It's a really, really good system. We couldn't do without it now. Even though we've only had it for a year, it seems like it's been there forever. And I wouldn't want to go back to any other system because it's absolutely amazing.